The first one is an assertion reason question. The assertion is that the interpersonal relationship is the enabling factor to solve the problems of individuals through casework process. The reason is establishing professional relationship can help in solving the problems of individuals. The assertion reason question, these are the codes given here, that A is true but R is false. Next is A is false but R is true. Next is both A and R are true and R is the correct explanation of A. D is both A and R are true but R is not the correct explanation of A. So here the assertion is that the interpersonal relationship is the factor which is used to solve the problems of individuals. This is a correct statement because interrelationship building, the rapport building which happens during the intake process is very essential to keep the process of casework ongoing. So this stage is very important in any caseworker client relationship. So the assertion is true, and the reason given here is that establishing professional relationship can help in solving the problem of individuals. Exactly what the purpose of the whole caseworker client relationship is, that once this relationship is built, it is quite easy to solve the problems of that particular individual. So the reason which is given here for the assertion is true and is the correct explanation. So the correct option will be C. Both A and R are true and R is the correct explanation of A. Next question is, decision making means A. choosing among alterations, B. choosing among alternatives, C. choosing for allocations. The correct option is choosing among alternatives. So decision making is all about choosing from whatever options we have. So the correct option is B, choosing among alternatives. The next question is, grapevine communication relates to A, formal communication, B, informal communication, C, upward communication, D, downward communication. The correct option is informal communication. Next is, dash describe the process by which a course of action is selected to deal with a specific problem. A, decision making, B, goal setting, C, strategic planning, D, organizational planning. So an action is selected to deal with a specific problem and it is based on making that first decision. So the correct option is decision making. Next is match the following question. List 1 has the theories: A, phenomenological, B, psychoanalytical, C, motivational, D, learning. List 2 has the name of the proponents: 1 Skinner, 2 Maslow, 3 Carl Rogers, 4 Sigmund Freud. Now you have to match the correct theory with the correct proponent. So the phenomenological theory, it was given by Carl Rogers, so A3. B, psychoanalytical theory, was given by Sigmund Freud, so B4. Then the motivational theory, it was given by Maslow, as we know it as the human motivation theory, so C2. And then the learning theory, it was given by Skinner as in theory of learning, operant conditioning, so D1. So the correct option will be B, A3, B4, C2 and D1. Next question is, which of the following is not a principle of casework? A, specific objectives, B, confidentiality, C, individualization, D, evaluation. So the correct option is specific objectives. Rest all are the principles of casework. Next is, arrange the following in correct sequence: 1 diagnostic summary, 2 home visit, 3 intake interview and 4 referrals. So we have to arrange it in the correct sequence, the way as it happens in a casework process. So as we know, the first step would be referral, because the client who is coming to the organization is referred in some sort of a way. So the first step will be referral. Then the social worker will do an intake interview with the client. So the next step will be intake interview, and then there will be a diagnostic summary. Now since there is a option of home visit, so obviously that process of diagnostic summary will be done in home. So that's why we'll first put home visit and then diagnostic summary. Now if home visit option would not have been there, then you could have straight gone to diagnostic summary after intake interview. It can also take place in the organization itself, of course in a confidential manner in a separate room, but this is what the sequence looks like. So the correct option will be A, 4321, that is referral, intake interview, home visit, and then diagnostic summary. Next is a match the following question. List 1 has names of books and list 2 is the names of authors. List 1A, Introduction to Social Work. It was written by Skidmore and Thackeray. So the correct matching will be A with 2. Introduction to Social Work, Skidmore and Thackeray. Then B, Community Organization Theory and Practice. It was written by M.G. Ross. So B matches with 3. C, Social Casework Problem Solving Process. This book was written by H.H. Perlman, or Helen Harris Perlman is the full name. So the correct matching is C with 4. Then D, Introduction to Social Welfare. It was written by W.A. Friedlander, Walter A. Friedlander. So the correct option is B, which is A2, B3, C4, D1. Next question is, which one of the following is not a part of social casework process? A, treatment, B, assessment, C, study, D, content analysis. So the correct option will be content analysis. The rest are all stages of the casework process. Next is, Diagnostic School of Social Casework was developed by A. Ross, B. Jung, C. Rank, D. Mead. So the correct option is D. Mead. The next question is, Paulo Freire's approach could be briefly stated as A, organization of services for people, B, mobilization of community leaders, C, action reflection process with people, or D, identification of target systems for work. So the correct option is actually C, action reflection process with people. Now if you've read a little bit about what Paulo Freire's approach was all about, he gave this philosophy of education which says that students, they should play an important and active role in their own way through their own learning, instead of being just the recipient of the knowledge which is being given out. They should actively participate in the knowledge dissemination or knowledge participation, or just discussion. So that should be the whole idea of active learning, and this was proposed by Paulo Freire. Next question, the principles of social casework are joint decision making, acceptance, non-judgmental attitude, individualization. So here 2, 3, 4, that is acceptance, non-judgmental attitude and individualization. These are all principles of social casework, but joint decision making is not. So the correct option for this question will be D, which is 2, 3 and 4. Next is, treatment in social casework involves A, counseling, B, environmental modification, C, administration of social services, D, counseling, environmental modification and administration of social services. So the correct option will be D, because these are all a part of the treatment process in social casework. Next question is, arrange the process of communication in sequence. A, coding, decoding, recipient channel. B, channel, encoding, recipient, decoding. C, channel, decoding, recipient, encoding. D, encoding, channel, recipient, decoding. So the correct option for this one will be D, encoding, channel, recipient, decoding. So for this question, it is just essential to know what the meaning of these terms mean. Accordingly, it will be easier to arrange them in this sequence. Basically, encoding means to turn the message into a series of meaningful words, and then that words is actually channeled through a medium to the recipient, and then the recipient decodes the message. So this is the sequence of communication process. Next question is, identify the correct sequence regarding stages in social case work. So we know the different stages in social casework, how it moves from one stage to another. So remembering those stages is important so that these sort of questions can be answered. So the options are A, study, make, social diagnosis, treatment, termination, evaluation. B, intake, study, social diagnosis, treatment, evaluation. C, intake, study, social diagnosis, treatment, termination. D, study, social diagnosis, intake, treatment, termination, evaluation. So very helpful way to strike out the options which are not relevant is that treatment will always be the last stage of a social casework process. So here we can easily strike out C and D, because here the last stage is given an evaluation. So termination is always the last stage. So we will have to make the choice between A and B. So here the correct option is B, because first step in the social casework is intake, then you study, then you make a diagnosis of the client, then you devise a treatment plan, then you do the evaluation, and then termination. So the correct option here is B. Next question, social casework aims at giving charity to client, B, controlling the client, solving the problems of the client, enabling the client. It's a very straightforward question. The answer is solving the problems of the client. Correct option C. Next is, psychosocial approach in social casework is dependent on behavioral thought, Freudian thought, client-centered therapy, or transactional analysis. The correct option is client-centered therapy.